The question 2 about the cervical vertebrae. Question number 1, this station about cervical vertebrae. Question number 1, what is the specimen? This specimen is a typical cervical vertebrae C3 to C7. Are typical cervical vertebrae. This picture happens to be of C3 vertebrae. Actually, the characters of the cervical vertebrae are large triangular vertebral foramen, but the transverse process is small, containing foramen. The body is small also, but the spinous process is short. Again, to memorize, the body is small and the transverse process is small, but the triangular vertebral foramen is large. What about the spinous process? Is short and pivot. Short and pivot spinous process to the symbol A. So the third question is identify the parts of the labeled from A to G. A is spinous process, pivot and short. A is spinous process, pivot and short, but B is posterior tubercle of the transverse process, but C is anterior tubercle of the transverse process. But asking about D is superior articular process. Again, to memorize, A is spinous process, which is short and pivot, from C3 to C5, short and pivot. But B is posterior tubercle of transverse process and C is anterior tubercle of transverse process. D is superior articular process. Again, D is superior articular process. E is transverse foramen. F is vertebral foramen. E is transverse foramen. F is vertebral foramen. G is the body of the vertebrae. Memorize body of the vertebrae is wide and small. Okay, characterize is wide and small. The next question, question 4. The vertebrae arches articulate with each other by the way of synovial joint. Describe the articulation between each adjacent vertebrae. The articulation by the synovial joint almost is on the coronal plane. The cervical region thereby so allowing for lateral flexion and forward flexion and extension. Again, these synovial joint allow for lateral flexion and forward flexion and extension. This is cervical region, coronal plane, attached to each other by synovial joint. Move to next question 5. Uncus and its significance. The uncus is small and turned lip on the upper lateral margin of the cervical vertebrae. They form a convertible joint with successive vertebrae and allow rotational movement. Again, they form unconvertible joints with successive vertebrae and allow rotational movement. They are small and turned lip on the upper lateral margin of the cervical vertebrae. They form unconvertible joint with successive vertebrae and allow rotational movement. Number 6. The right and the left vertebral artery. What is the attachment are given by anterior and posterior typical? No. Number 6. What is the travels through the transverse foramen? Is the right and the left vertebral arteries Branches of subclavian ascend toward the skull through the lined by up transverse foramen of the cervical vertebrae. Number 7. What attachment to are given by anterior and posterior tubercle? Attachment scalenus anterior, scalenus medius, scalenus posterior muscle in the neck. Question number 8. What is significance of spinal of C7? Can be palpated, so can be used to identify the spines of the vertebrae below this level. The 7 cervical vertebrae is called vertebra prominent. Number 9. Question number 9. Ligaments, anatomy of the cervical spine. The answer is anterior and posterior longitudinal ligament and on the posterior and posterior surface respectively. The vertebral process are also joined by supraspinatus and interspinous ligament. Also there is intertransverse ligament between the transverse process. Again, to memorize, there is anterior longitudinal, posterior longitudinal, supraspinatus, interspinatus, intertransverse ligament. The last question: what is the clinical significance of cervical rib? Cervical rib arises from the anterior tubercle of the 7 cervical vertebrae is a congenital anomaly. Thank you.